This is a full upper arch bioengineered surgical case by Impronto Inc. One-click treatment plan. You click on the eye view and you get to watch the whole treatment from A to Z. This represents the preoperative photos of the fully edentulous upper arch. Patients wearing a full upper denture. Looking at it from the lower right lateral view, noticing the lower molar that will be extracted as well. Also a lower left molar all the way back that's coming at a mesioangular angulation there that will be extracted. This represents the radiographic guide that the patient's wearing, noticing that the midline is way off while the radiographic guide was seated and the patient was actually scanned. This will be compensated for at the time of the surgery. Surgical guide is placed with 4 anchor pins and the bite registration material that is used that's made out of polyvinyl siloxane. This will ensure the positioning of the surgical guide in place before the anchor pins are secured. The guide is placed, ensuring that there's no mobility on it, and the surgeon will use these inserts in order to start the osteotomy using various drills. Flapless technique usually involves utilization of the actual drill punches that will remove the tissue before starting the osteotomy. This is like 2 drills set in one. Then the surgeon will use the insert, go with the 2mm twist drill, and go through the insert and take it to the depth. Continuously, he goes on to the narrow platform using the insert as well. Then if the final is a regular platform, he would use an osteotome to compact the site in order to condense the bone. The implant mount is added into the implant. The surgeon picks it up with his drill, and then he takes the implant mount, implant assembly with the driver and goes through the actual sleeve into the guide and into the patient's mouth. The implant is seated about 2 to 3 millimeters off on purpose. Then surgeon goes to the opposite side, tries to place the implant on the opposite side as well. Same technique, utilizing the 2mm insert and 2mm drill down to depth based on the treatment plan that was presented to him. Then same again, osteotome is used to expand the site. And in many instances, if bone grafting is necessary, bone grafting is added in there, compacted into the site with the osteotome one more time to depth before implant placement. Implant is then placed into the site, ensuring that it will be seated at least 2 to 3 millimeters off the sleeve. Once the 2 posterior implants are placed, the surgeon proceeds to place the most anterior implant, 2mm drill, into the osteotome. In this case, this is a narrow platform. Then, after condensing the osteotomy with the osteotome, the implant is introduced through the guide as well. So now the surgeon has secured 2 implants in the posterior, 1 implant in the anterior, ensuring an occlusal stabilization of the guide. Notice all 3 implants are 2 millimeters off the actual sleeve in order for us to use the wheel car technique in order to position all the implants and the guide all at the same time. From this point on, the surgeon proceeds to place the other implants. In this case, he goes on to tooth number 9, 10 area to place the other implant, and now he's got 4 implants placed through the guide. All 4 implants are placed now. We have ensured the occlusal stability of the actual guide. The surgeon goes posteriorly now to place the 2 most posterior implants, and he goes from the right side then to the left side, placing now 6 implants, 4 in the posterior region, 2 in the anterior region. The last 2 implants to be placed will be into the canine positions on number 6 and number 11, and once these implants are placed, the surgeon takes the hand torque and start torquing these implants all the way down until they are flush with the guided sleeve. And once again, the wheel of the car is utilized, positioning like the bolts of the wheel of the car in placement of these final implants to be flush with the guide. All 8 implants are placed. Now the surgeon is going to proceed by removing these implant mounts, and once all implant mounts are removed, the surgeon then proceeds to remove the anchor pins, and now you can compare the original ridge with the final ridge. Flapless technique, all implants placed, very minimal amount of bleeding, and the patient has the healing abutment placed and he's ready to go home with a relined denture in place.